If we could go to the next slide. I would just like to walk through a few things about our technology today to make this chat flow well for you. The meeting is being recorded and the slides will be emailed out to everyone. If you have any issues with it being recorded, you certainly are free to leave the webinar and we'll send you a recording, but we are recording today. We do ask that all the questions be placed into the chat today. And we have some staff standing by that may be able to answer those, and we will try to answer questions as they come in. But if not, we will follow up with you. Also want to let you know that closed captioning is available to you today on this if you should need it. And likewise, if you need any technical support with Zoom while you're on the webinar today, if you will chat from our staff, Elizabeth Williams, directly in the chat, she will be able to give you some assistance. Next slide. Today, we are going to be talking about one of our favorite issue areas, tobacco control. And you know, this year, we will this fall be celebrating 40 years of advocacy work here at the American Heart Association. And one of the very first issues we took on was tobacco issues. And in fact, when I first started at the Heart Association, it was the first campaigns that I got involved with was tobacco tax campaigns. Today, we're going to talk about why we're still engaging in tobacco control, why it's as important today as ever. We're going to hear from part of our team that works on the Hill and get an update from Capitol Hill. We'll talk about the latest on FDA regulation of tobacco control. And then we're going to hear how You're the Cure and the Heart Association are seeking to empower our youth to reach the tobacco endgame. So it's a full half hour. And just as a reminder, after our webinar today, you'll be able to jump over to office hours with your grassroots managers, hear more about what's happening on local and state tobacco policy. So why do we continue to engage in tobacco control policy? Well, I think you already know that tobacco use can cause heart disease, stroke, cancer, and other chronic diseases. Nearly 1 in 3 deaths from coronary heart disease stems from tobacco use. I think one of the most important things that we all need to remember is that death by tobacco-related causes is the most preventable cause of death in the United States. And then finally, even though we've made incredible progress over the years reducing the use of traditional cigarettes, that hasn't stayed. So what is happening today? So about over a dozen years ago now, we saw the growth of electronic cigarettes, and they have come with easy to use flavors like fruit and candy, and they have fueled a youth tobacco epidemic. And all the progress that we have seen has started to slip through our fingers. New products often have extremely high levels of nicotine. These e-cigarettes can have variable amounts of nicotine in them. And according to our US Surgeon General, exposure to nicotine during adolescence for young people can cause addiction and harm to the developing brain. As the years have gone on and the more research we've done, we continue to learn more about how the use of these products impact our young people. They are marketed to our young people, and unfortunately, our youth frequently falsely believe that e-cigarettes and other flavored products like hookah are safe. They think they might just have water vapor, and it is not the case. And sadly, what our data does tell us is that e-cigarette use has risen dramatically among our students, 80% for high school students and nearly 50% for our students in middle school. So what are we focusing on? Now, you will probably be hearing through You're the Cure a lot about local and state policy efforts that may be going on in your communities. But we are also focusing on this at a national level, bringing all the resources to bear. And so we're hoping to remove the appealing and easy to use flavored tobacco products from the market. We are looking to restrict tobacco companies' ability to market their products through celebrity endorsements and sponsorships. We are looking to put graphic warning labels and nicotine concentration information on all tobacco products, not just cigarettes, but all products, and expand and strengthen our tobacco cessation programs. So today, I want to take a moment and introduce to you Emily Horowitz. She is part of our federal advocacy team working on Capitol Hill, gets to go up to the Hill and meet with our lawmakers, as well as do regulatory work with us. She not only works on our tobacco issues, but also our maternal and child health issues and nonprofit issues. And so today, Emily is going to talk with us about the work that's happening federally, both from a legislative angle and a regulatory. And with that, I will pass things over to Emily.
Thanks, Betsy, and thanks everyone for joining today. I loved seeing everyone commenting in the chat box where they were calling in from. I'm coming at you from Washington, D.C., and I'm excited to give you some federal policy updates, starting first with some upcoming FDA action. This is very soon, very exciting. We are fast approaching a major deadline for the regulation of tobacco products. The Food and Drug Administration, or FDA, has until September 9th of this year to issue a decision on thousands of pre-market tobacco applications for new tobacco products. This means that many e-cigarette and cigar manufacturers will soon learn whether or not their products can stay on the market. And before I go into what this means for AHA, I'm going to take a quick step back and explain what is a pre-market tobacco application and who is required to file one. Next slide, please. Thank you. So a pre-market tobacco application, or PMTA for short, is a submission from a tobacco product manufacturer to the FDA asking for authorization to be on the market. The application process includes information about the product's reported health risks, the ingredients or components, how the product will be labeled, and more. The FDA then uses this information to evaluate the tobacco product and determine if it should be allowed on the market. These are specifically applying to what's considered a new tobacco product. And a new product is any product that was not on the US market as of February 15th, 2007, or any existing product that was modified after February 15th, 2007. So that could be a product with a change in its design, a component or ingredient has changed, or the content or form of nicotine has changed. And as you can imagine, this is mostly applying to a lot of e-cigarettes, since the e-cigarettes on the market in 2007 have changed dramatically from what's on the market today. Per a court order, PMTAs for many of these new products were due by September 9th, 2020, and manufacturers that met this deadline have been allowed to keep their products on the market for up to 1 year while FDA reviews their application. FDA received over 6.5 million PMTA applications from over 500 companies. The overwhelming majority were for various e-cigarettes and e-liquids of different flavors and nicotine concentrations. To be consistent with the court order, the FDA is supposed to have a decision on these applications by September 9th of this year, which is what we're waiting for. And we can go over to the next slide now. So as FDA reviews these PMTAs, they're going to be considering what's considered the public health standard, which is whether a product is appropriate for the protection of public health. This involves weighing the risks and benefits to the population as a whole, both to the product's users and non-users. The FDA is going to consider the likelihood that existing users of tobacco products will stop using these products, and the likelihood that those who don't use these products might start using the products. Any product must also meet any manufacturing requirements. The proposed labeling cannot be false or misleading, and the product must meet any applicable product standards. If the FDA denies a PMTA and issues a negative order, the manufacturer must immediately remove the tobacco product from the market or risk FDA enforcement. So normally we would expect to see that these marketing orders would be granted or denied, but because of the large number of PMTAs that were submitted, FDA has indicated that it will not be able to review all of them by September 9th. It's unclear what exactly is going to happen to the products that are not reviewed by the deadline, but we could see FDA act on a case-by-case basis to allow individual products to remain on the market while they complete the review. We could see these products ordered off the market until FDA completes the review, or we could see FDA go to the court and seek an extension of the September 9th deadline. That said, we do expect to have the final decisions on many of these tobacco products by the September 9th deadline, including a lot of popular products like Juul and Vuse, because the FDA has dedicated a significant portion of its resources to reviewing those products that make up the largest market share. Next slide, please. Thanks. So as you all know, AHA believes that no flavored tobacco product should be authorized for sale because none can meet that public health standard of being appropriate for the protection of public health. But we recognize that we don't know exactly what FDA is going to do, and they may issue a marketing order for a flavored product. If this happens, we're going to face some new challenges in our advocacy at the federal level, the state level, and the local level. For example, it might be increasingly difficult to convince policymakers that all flavored tobacco products should be removed from the market if the FDA has issued a marketing order for one or more of these flavored products. While FDA authorization of a flavored product might make our work more difficult, we do anticipate that AHA's policy goals at all levels of government will remain the same and will continue to advocate for the removal of all flavored products from the market or prohibited for sale, which is the action taken on the state and local level. So clearly, FDA's actions on September 9th and afterwards is going to impact our legislative work. I'm going to shift gears now to talk a bit about some of our other legislative priorities and how they might change after September 9th. The first bill I want to talk about is the Quit Because of COVID-19 Act. This is a bill we're focusing on the federal level, which would ensure that all Medicaid and children's health insurance enrollees have access to all evidence-based tobacco cessation treatments without cost sharing and with no prior authorization required. These are two of the big obstacles to accessing cessation tools, so it's really important that this bill breaks down those barriers and makes it easier for individuals to access this cessation tools. Additionally, for the duration of the COVID-19 public health emergency and for 2 years following, the bill would enhance federal funding to cover the full cost of this benefit and a state outreach campaign to educate both providers and enrollees about it. This bill is particularly important given the evidence that we've seen that tobacco users are at an increased risk of complications from COVID-19. Tobacco use is also a key driver of poor health outcomes and health costs for Medicaid, and Medicaid enrollees smoke at twice the rate of adults with private health insurance. So AHA, we are working with our partner organizations and allies on the Hill, really hoping to advance this in a future legislative package. We see this as something that has bipartisan support, and we really see a chance to move this forward in the near future. The next bill I want to bring up is the Tobacco Tax Equity Act. This bill would apply the first federal tax to e-cigarettes. It would also double the current tax rate for cigarettes, and it would establish tax parity by bringing the tax rate for all products up to the same level as cigarettes. It's expected to reduce tobacco use, particularly among youth who are the most price sensitive. It would reduce healthcare spending and generate significant federal revenue. Tobacco use costs more than $325 billion a year in direct medical care and lost productivity. Increasing the price of tobacco products is the single most effective way of reducing tobacco use, with the study showing a 10% increase in cigarette prices would result in a 3 to 5% reduction in consumption. Unfortunately, raising the tobacco tax does not have bipartisan support in the current Congress, so this is going to be a much more difficult bill to try to move forward. That said, we are bringing it up in discussions as an option to raise revenue for other projects, such as the infrastructure bill, this large package that Congress is currently working on that is going to have a hefty price tag along with it. Next slide. The last bill I want to bring up is one that you might remember from last year, the Reversing the Youth Tobacco Epidemic Act. This bill passed the House in February 2020, which was a huge victory. And it was a comprehensive bill to protect both youth and young adults from tobacco and reduce tobacco-related health disparities. One of the main components of the bill was to prohibit all flavored tobacco products, including menthol cigarettes, but it also had several other things that it did to create a safer world for our youth. This bill was led by the Energy and Commerce Chairman, Congressman Pallone, and it does remain a priority for him, but his staff is waiting on FDA's decision on flavored products before they decide to take any new action. It's likely they would reevaluate the bill from last year, see what updates need to be made, but we really can't figure any of that out until we see if FDA does grant any of those PMTAs to flavored products. So I am in close contact with his team, and we'll definitely be reaching out to the You're the Cure network with updates going forward. Thank you all for the opportunity to share some of these federal updates. I know I shared a lot of information today, and I'm sure the grassroots team can answer some of the questions during your breakout sessions in a bit. But I just wanted to thank you again for taking the time to listen and for your ongoing commitment to the tobacco endgame. I look forward to working with you to advance these policies, and I'll hand it back to Betsy.
Thank you so much, Emily. That really was information packed and we appreciate it. I have seen a couple questions come into the chat box and we will get to those. I do want to cover all the material and then we'll circle back around. And if we run out of time, we will follow up with you directly to get some answers to your thoughts and questions. And so now I want to pivot a little bit and really talk about what can we all do to impact this process. And welcome back to our chat, Amy Schoep-Manzi, our Director of Grassroots Advocacy here at the American Heart Association. And Amy is going to discuss with us today a new initiative of You're the Cure that we have rolled out. So Amy?
Hi, Betsy. Thanks so much for having me. And again, it's so nice to see folks joining these calls, both advocates who've been with us a long time and new friends. And so I'm really, really happy to be here and to talk a little bit about our Tobacco Endgame campaign.
Well, we are really glad that you are with us today. And I personally am super excited about today's topic of the Tobacco Endgame, because this is an initiative that I think for Amy and I and the work that we've been doing is something very close to our hearts. And that is the work that we get to do with young people. So Amy, can you tell us a little bit about the Tobacco Endgame effort, why we're doing it, and what the goals are for Tobacco Endgame?
Yeah, absolutely. So the Tobacco Endgame you mentioned is a movement within our You're the Cure environment. And so you can see a little sneak peek, a little snapshot of the website there. And you can learn more and check out the site at tobaccoendgame.org. But I am so excited about this campaign because it is really about empowering and engaging young people to make a difference in our efforts around tobacco control. And so this campaign is primarily geared for teens and young adults, although we appreciate the participation of all the folks in their lives, right? Teachers and parents and our advocates who support young people. But this is really meant to be a youth-led campaign. It's meant, we believe strongly that this generation of young people, today's teens and young adults, can be the generation that brings about the tobacco endgame, that ends the cycle of nicotine addiction for good. And we want to support their efforts to do that. And we want to take their great ideas. We believe that if we're trying to do something for young people, change the dynamic for young people should lead the way. My teens tell me routinely that I just don't know what it's like to be a teenager these days. And so we want to hear from young people, from teens, from young adults, those early college students. what it's really like in their world, in their society, and how they think we can make this impact. And I think one of your questions was why, you heard from Emily, there's over 6 million products more out there that are targeting young people, their favorite candy flavors, fruit flavors, things like that, that make them think this is really fun rather than really dangerous. And it covers up some of that danger. We want to combat that with good information about the dangers of vaping and tobacco use. And at the same time, you referenced the dramatic increase we've seen in youth using these products. And so we want to be sure that the young folks who are concerned by what they're seeing around them, concerned because they're seeing friends vape in the bathroom at school and they're seeing, incredible use of these products and they know that they're dangerous, we want to equip them to do something about it. So that's what the campaign is all about. And again, it really is meant to be youth-led. So we're excited to have young folks coming in through the campaign and helping inform our strategies going forward.
That's great, Amy. Could you now just tell us, so once a young person joins Tobacco Endgame and signs up, what can they expect? What will they be asked to do? What do you envision comes next?
Yeah, so for one thing, they can expect to be engaged in our tobacco policy campaigns. You heard Emily talking about the things that are happening federally, our desire to remove flavors. That work is also happening in communities and in states. And so the young people who join the Tobacco Endgame can expect to hear from our grassroots managers, both state and local and federal, about ongoing policy campaigns where their voice could help make a difference, where they could help move an elected official. And I do think it's so important that young people understand there is a place for their voice in this dialogue, a place for them to share the real experience, what it's like to be targeted by these products, what it's like to see their peers and friends using them and to have concerns, what it's like once you've been sort of duped into taking on these products to try and quit them. And that's why the voice of young people in the midst of this experience is so important. So they can expect to be invited to engage in those policy campaigns. But more than that, the AHA has a lot of resources to help them carry the message in their schools. We have a tobacco-free schools toolkit that they can help carry to their teachers and their administrators. They can expect to be given resources to engage their peers. They can expect to have the tools and the opportunities and the resources of the AHA at their disposal as they tackle this problem in their own communities. And so they should expect to share their ideas with us and to be heard. We want to know how they think they can make a difference in talking to their peers and in engaging their schools and their communities in this work. And then we want to make sure that we provide the resources and, our mechanism for contacting elected officials, for example, we want to give them the resources and empower them to help drive forward this policy change that will ultimately reduce tobacco use and reduce the marketing to young people that we're seeing so prevalently right now.
That's great. And it's so exciting to see young people take charge and move forward to change their world. And so it's an exciting time for us. So one final question for you, Amy, would be, for everybody that's with us on the webinar today, how can they and other advocates help us spread the word about Tobacco Endgame?
Yeah, I appreciate that question, and I appreciate everyone who will help us spread the word because we want to spread it far and wide. So tell the young people in your life about Tobacco Endgame, tobaccoendgame.org. They can come there and find more information. And when I say young people, I'm referring to teens and young adults, but certainly, visit yourself, sign up if you're not even in that age demographic. We want you to support the campaign, but help us spread the word. Use your own networks. There are social resources at the bottom of the page. So visit tobaccoendgame.org, get familiar with the site a little. At the bottom, there are some cards you can take to include in your Instagram story, to put in your TikTok video. And so we'd encourage people to use their social media network to help spread the word. to share it in their schools with their peers. Just help spread the word. I saw a few questions, and I know we'll follow up with folks who were asking how they can help in their networks promote. We're happy to get you resources and links and work with you to engage young people and provide them resources. So yes, just tell everybody, use your networks, your existing networks, use the social resources that exist, and do help us spread the word. We're so excited to have a movement really led by young people, and really look forward to folks sharing their stories and their experiences with our elected officials and their peers and with all of us.
Thank you, Amy. And if we could go to the next slide, because Amy and I want to make sure that everybody that's on the webinar today gets the opportunity to sign up for the Tobacco Endgame. And it's super simple for you to do today. You can just do it right on your cell phone.
Oh, Betsy, we lost your sound.
Oh no, sorry about that. Today, you can join us on Tobacco Endgame simply by using your cell phone and texting the word Endgame to 46839. Super simple to do. When you do that, you'll get a text message back with a link, and it'll take you right to the website. So once again, that takes you to texting Endgame to 46839. And so while we're wrapping up today's webinar, if you can be doing that on your phone, I've got a few little housekeeping things for us as we wrap up today. If you had a question in today's chat, we will be following up with you directly. You are now invited to join your grassroots managers that are in your region of the country for more conversation about what's happening. We have included, if we could go to the next slide, please. If just so you know, next week, our chat is going to feature our youth advocates. It is at a different time. It is still Tuesday, but it's going to be in the early, late afternoon, early evening, depending on where you are in the country. We are going to be joined by Cheyenne Byert, who is actually one of our youth advocates who is now sitting on our National Advocacy Committee, and she is going to interview a panel of youth advocates representing folks from all across the United States. So it's going to be a very special time and an exciting time to hear from our young youth advocates. This afternoon, you do have and are invited to our office hours. If we could go to the next slide, there we go. If you will look for your section of the country, and in the chat box, you have a hyperlink that will take you to your Zoom office hours with your grassroots managers, where you can continue this conversation, learn more about what's happening at the local and state level with tobacco policy. And once again, just to say thank you for joining us today. If we had questions, we're going to get back in touch with you. And please join us next week. We know it's at a different time, but I think hearing from our young people will be an incredible opportunity. Thanks again, and we wish you a great day.